Personal protective equipment, or PPE, is designed to protect your eyes, nose, mouth, and respiratory system from airborne contaminants such as fibers, dust, gas, and vapor. There are different types of PPE. The level of the PPE you need to wear to complete the task is crucial. This video shows you how to correctly and safely put on, wear, and remove a level 4 personal protective equipment. The materials and equipment needed are the following: hand soap, shoe cover, double gloves, gown or coveralls, N95 masks, surgical cap, goggles or face shield, and disinfectant.
The donning process is guided and supervised by a trained observer who confirms visually that all PPE is serviceable and has been donned successfully. The trained observer should use a checklist to confirm each step in donning PPE and verify the integrity of the ensemble.
Remove personal clothing and items. No personal items such as accessories, cell phones, and pens should be brought into the patient room. After inspection, the medical technologist may now perform hand washing.
Put on shoe covers. This step can be omitted if wearing a coverall with integrated socks.
Put on the first pair of gloves.
Put on gown or coverall. Ensure gown or coverall is large enough to allow unrestricted freedom of movement. Ensure cuffs of inner gloves are tucked under sleeves of the gown or coverall.
Put on N95 respirator. Complete a user seal check. You may also add masking tape to ensure that it is sealed properly.
Put on head cap and followed by surgical hood. Over the N95 respirator, place a head cap and followed by surgical hood that covers all of the hair and the ears and extend past the neck to the shoulders. Ensure that the hood completely covers the ears and the neck.
Put on face shield. Put on a full face shield over the N95 respirator and surgical hood to protect the eyes as well as front and sides of the face. Put on a second pair of gloves and ensure that the cuffs are pulled over the sleeves of the gown or coverall.
The PPE should be visually inspected to be worn to ensure it is in serviceable condition.
No exposed clothing, skin, or hair of the healthcare worker should be visible at the end of the donning process.
Inspect the PPE to assess for visible contamination, cuts, or tears before starting to remove. If any PPE is visibly contaminated, then disinfect.
Disinfect outer gloved hands. Remove and discard outer gloves, making sure not to contaminate inner gloves during the removal process.
Inspect and disinfect inner gloves.
Remove face shield. Care must be taken not to touch the face when removing the face shield.
Disinfect inner gloves. Remove head cap or surgical hood. Unfasten surgical hood. Gently remove and discard. Disinfect inner gloves.
To remove coverall, tilt head back to reach zipper or fasteners. Unzip or unfasten coverall completely before rolling down and turning inside out. Avoid contact of scrubs with the outer surface of the coverall during removal, touching only the inside of the coverall.
Disinfect inner gloves. Pull off boot covers, taking care not to contaminate scrub pants legs.
Disinfect and change inner gloves. Remove and discard gloves, taking care not to contaminate bare hands during the removal process. Perform hand hygiene with ABHR. Don a new pair of inner gloves.
Remove without touching the front of the N95 respirator. Then discard N95 respirator.
Disinfect inner gloves.
Disinfect washable shoes.
Disinfect the inner glove hands. Remove and discard gloves, taking care not to contaminate bare hands during the removal process. Perform hand hygiene.
Healthcare workers can leave the PPE removal area wearing dedicated washable footwear and surgical scrubs